Sciatica. If you've ever had it, you know exactly what I'm talking about. That shocking, just debilitating nerve pain. But what if surgery wasn't the only option on the table? Today, we're going to dive into some of the most effective, non-surgical ways to find relief, all based on solid research. So let's get you on the path to feeling better. Does this sound a little too familiar? That sharp, almost electric jolt that travels? That is the classic calling card of sciatica. It's a feeling that is, believe me, very hard to forget, and even harder to ignore. And it's what sends so many people looking for real answers. Here's something that's really crucial to understand. Sciatica itself isn't actually the root problem. Think of it more like an alarm bell going off in your body. It's signaling that something else, maybe a herniated disc or a bone spur, is pinching or irritating your sciatic nerve, which, by the way, is the longest nerve in your entire body. So our goal today is to figure out how to quiet that alarm for good. Okay, so before we can even talk about solutions, we've got to be crystal clear on what we're dealing with, right? Let's get really specific about the telltale signs of sciatica, what it really feels like. The experience can be all over the map, honestly. For some, it's a dull ache. For others, it's a sharp, burning pain. You might get that classic pins and needles feeling, or even notice some muscle weakness down your leg. And there are two classic hallmarks. It almost always picks a side, just one side of the body, and something as simple as a cough or sneeze can suddenly make that pain spike like crazy. So who's most likely to go through this? Is it just a part of getting older, or is there more to the story? Let's unpack the risk factors, because I have a feeling some of them are going to surprise you. Now I find this fascinating because it's a total paradox. On one hand, if you sit for long periods, you're more prone to sciatica. Makes sense. But on the other hand, so are some endurance athletes whose muscles are overworked and super stiff. It's just a powerful reminder that balance is absolutely everything. And of course, other things definitely play a major role. Age is a big one. Just the natural wear and tear on our spines can lead to things like herniated discs or bone spurs that press right on that nerve. And other health conditions, like obesity adding stress to the spine or diabetes, which can affect nerve health, well, they increase the risk too. Okay, we've talked about the pain, we've talked about the causes, and I know that can all feel a little daunting. But now we get to the most important part of this whole explainer, the good news. And trust me, there is a lot of good news when it comes to recovery. 50%. Just let that sink in for a second. This number comes from the Cleveland Clinic, and it's so important. It means that nearly half of all people with sciatica find their symptoms just get better on their own within about 6 weeks. That's a powerful statistic that really speaks to the body's incredible ability to heal itself. And this really puts that timeline into perspective. For so many people, this is not a life sentence. The body has this amazing ability to reduce inflammation and heal without any drastic measures. So patience and the right kind of conservative care can truly make all the difference. And this, right here, is the key takeaway from the experts. Yes, surgery is an option for some really severe cases, but it is almost never the starting point. The consensus is that those conservative, non-surgical treatments are incredibly effective and should pretty much always be your first line of defense. So what do these effective treatments actually look like in practice? We're going to start with the things you can do yourself, maybe even right now. Think of this next section as your own personal movement toolkit for finding relief. The mechanics of this are actually pretty straightforward. When the muscles around your glutes, your hips, and the backs of your legs get super tight, they can kind of pull on your whole lower back, increasing the strain. So, by gently stretching and strengthening these areas, you relieve that pressure and you give that sciatic nerve the space it needs to finally calm down. Okay, here is a fantastic stretch for a muscle called the piriformis. It's this small muscle deep in your glutes that's often a big troublemaker in sciatica. So as you follow these steps, just remember the key word is gentle. Don't force anything. You should feel a nice, deep stretch in your glute, not sharp pain. Just breathe into it, hold, and then don't forget to do the other side to stay balanced. And here's another excellent option that hits it from a slightly different angle. As you pull that knee across your body, try to keep both of your shoulders flat on the floor. That's going to deepen the stretch in your hip and lower back. Again, the goal here is a gentle pull, not pain. Hold it for 10 to 30 seconds and then switch. Now, while these stretches you can do at home are super powerful, you absolutely do not have to go it alone. Building a support team of professionals can make a world of difference. So let's look at some of the key players who can be on your team. There are several great options to explore.
You've got chiropractic care, which focuses on spinal alignment to take that direct pressure off the nerve. Therapeutic massage is amazing for releasing those deep, tight muscles like that piriformis we were just talking about. And some studies even suggest that acupuncture can be effective, possibly by helping to calm down nerve signals and release the body's natural pain-relieving chemicals.
And hey, don't underestimate this simple tool. Here's the rule of thumb. In the first day or two of a flare-up, go with cold. Ice packs help reduce inflammation and swelling. After that initial period, switch over to heat. A heating pad helps relax those tight muscles and gets more blood flowing to the area, which promotes healing. Simple, but effective.
Now, if other methods just aren't cutting it, a doctor might talk to you about medication. This can start with over-the-counter anti-inflammatories like ibuprofen. From there, they might suggest prescription options like muscle relaxants or even targeted steroid injections to calm things down right at the source. But you might also notice some surprising things on this list, like certain antidepressants or anti-seizure medications. And that raises a really interesting question.
And the answer lies in this important concept called off-label use. This is basically when a doctor prescribes an FDA-approved drug for a reason other than what it was originally designed for. It's perfectly legal, and it's actually really common. It just so happens that some of these medications are excellent at changing how our brains perceive pain, or at calming down those misfiring signals from an irritated nerve, making them a powerful tool for nerve pain like sciatica.
Whew, we have covered a lot of ground, from stretches and therapies to medications, so let's bring it all together and talk about your path forward from here.
If there is one thing to take away from all this, it's this. While sciatica can be incredibly painful, it is also highly treatable. For the vast majority of people, the road to relief does not lead to an operating room. It leads through proactive steps like movement, therapy, and all these targeted treatments. There is a clear, effective path to feeling better.
So much of the power to manage this is in your hands. You now have this toolkit, and it's filled with knowledge, with stretches, with therapy options. Of course, the best first step is always to talk with your doctor to build the right plan for you. So, you have your toolkit. What's your first step going to be? The journey to relief can start right now.